We have to triple our workforce by 2050. No one's suggesting that this isn't going to be a real challenge, but there are some initiatives in the budget last night, including more training places, including funding to support the caring industries to attract more people. We do obviously need to address wages in aged care. Our staff do remarkable work. They're undervalued and underpaid. Last night's budget didn't have particular measures around that, but there is work apace at the Fair Work Commission about the value of aged care work, and we'll be making sure that we can pay any increases that flow from that, and we will need to be working with government on that piece.
Okay, we've seen the Royal Commission say that aged care would cost about $15 billion a year. We've seen $18 billion allocated from the government over 4 years. There is a shortfall. Does the private sector need to step up here?
I think one of the things that we haven't sort of focused enough on is that there are a range of initiatives last night that obviously increase funding to the sector immediately. One of the most important recommendations, though, is the commitment the government gave to establish an independent pricing commission. This is important because it provides a level of independence and transparency in how aged care is funded. What that will do is actually cost what it costs us to deliver quality aged care, and then we'll price accordingly. And that's what's been missing in the past, that those two things haven't matched, and that's why we've seen the significant underfunding. This is an opportunity to correct that, because things like wage increases, indexation, etc., that needs to be taken into account so that costs are being met will happen through that independent pricing function, and that's a really important initiative.
Not everything happens overnight, we know that, Patricia Sparrow, but is there any immediate improvements we'll see after this budget?
So one of the immediate ones is the $10, or very quickly is the $10 per day for each resident coming in to support, basic daily care. So that's things like food. So that's additional funding that will go straight into the system. And obviously the home care packages, we would all like to be able to clear the wait list tomorrow if we could, but there is two good lots of 40,000 packages coming through, and we'll be working on that as hard as we can. We want to make sure that older people, their preference is to age at home, and we want to make sure they're supported to do so. But you're right, unfortunately, some of these things are going to take more time than is ideal, but we will be working really hard to make sure that everything can be introduced as quickly as possible, because we're focused on delivering quality care to older people.
Aged care is expensive in many cases. Do you think there is a problem with some centres putting profit before people?
I think that all aged care centres, whether they're not-for-profit or profit, operate under the same rules. And one of the things the package did last night too is introduce new transparency measures. So for that $10 per day per resident, providers will have to report how that's funded. We'll have a new star rating system that will bring in reporting on what our staffing is. So the concern that people have had around not enough transparency will be addressed in a number of measures that were introduced last night, and we're fully supportive of that.